To become a physical therapist, you need to go to the proper school. First of all, you need to get the prerequisites that the schools require, and that's usually chemistry, anatomy, physics, some biomechanical type classes, kinesiology. And other than that, the schools want to just make sure you have your bachelor's degree to start with, even a master's, but you have to have those prerequisites that they require on their application. Also, it's good to have experience from working in clinics as an aide or a technician, or even volunteer hours. And you can do volunteer hours or aide hours in a hospital, in an outpatient clinic. You can do it with home health physical therapy. There are a lot of different aspects. A lot of the schools like to see that you have had some acute care experience, meaning working in the hospitals. Technical skills in becoming a physical therapist usually come as you're in school to become the therapist, the hands-on experience. And so you're not going to get a lot of that as you're doing the work experience or you're doing the volunteer work to be able to go to physical therapy school. Going back to going into physical therapy school, you have to apply to an accredited physical therapy school. Here in the state of Utah, there is only one of those, and that's at the University of Utah. I went to a school in Texas, and they were transitioning between a master's degree to a doctorate degree, and at the time I was there, I received my master's degree. So there are various physical therapy schools all over the United States. You just need to find out which school is accredited, and that is the important thing. Personal skills you need as a physical therapist is you have to be people-friendly and a people person, be able to talk with them. And first of all, you need to make them feel comfortable as they come in, because most patients are a little sore or are complaining of pain. And I don't know about you, but if you have an injury, then sometimes you can be a little ornery, so you need to know how to work with those people. You have to have good hands-on skills, know how to hold the body part that you're working correctly so you don't cause more injury. You need to have multitasking skills, because a lot of times the way that the insurances are making it so reimbursement rates are lower, we have to have more patients. And to be able to have more patients, you've got to bring a lot of patients in. Therefore, you've got to be able to juggle patients and do certain things with patients at one time and then go to another patient and maybe come back to another patient. Where to go from here with your career. As you start out as a therapist, you'd start out as a staff therapist, and then from there, depending on your situation and where you're at, you can become a director of a clinic, director of a hospital. You can become an owner of a physical therapy practice. And so there are different ways to expound there. I also know a few therapists that have gone from owners of clinics or directors of clinics, and they have started doing other forms of physical therapy using their degree in ultrasonography, in diagnosing and helping